The endocrine system is one of the most delicate systems in the body, and ultimately it affects almost every other cell in the body. That means that when things go wrong with the endocrine system, they tend to go wrong in a pretty big way and have pretty system-wide effects. And here's where I'd like to talk about that. Probably one of the most common endocrine pathologies, although it's not truly a pathology because it's a part of the way your body is evolved to work, is stress. Stress is a natural phenomenon. It's a part of how your body adapts to deal with difficult situations. But when stress becomes chronic and it continues for too long, it can become pathological. It can disturb the homeostasis of the body. Stress is any situation that upsets homeostasis and threatens one's physical, emotional well-being. Some examples of stress: injury. Injury is definitely stressful. Surgery, which is basically just controlled injury. Infection of the body from outside sources, and even things like intense exercise past the point that's healthy. Pain causes you to produce stress hormones, and stress can be emotional as well. Intense emotions like grief, depression, anger, other things like that can all lead to stress. Stress affects your body in a 3-stage reaction, and it involves the production of several hormones. In the initial stage, it particularly involves epinephrine and norepinephrine, or adrenaline and noradrenaline, and in the middle to late stages usually involves glucocorticoids, especially cortisol. And for that reason, cortisol and other glucocorticoids are often called stress hormones. The first stage of stress is called the alarm reaction. And the alarm reaction is largely mediated by norepinephrine and activation of the sympathetic nervous system, and epinephrine from the adrenal gland. This kicks off what's normally called the fight or flight response, which we've talked about before. The fight or flight response prepares your body to expend lots of energy. Combat, running away, any sort of thing like that. These are all very energy-intensive activities. Things that the fight or flight response does is raise blood pressure, pulse rate, vasodilation to certain areas, and it liberates energy in the form of glucose from your liver. Stored glycogen in your liver is usually consumed, and your liver begins to put forth a lot of effort to make more glucose through a process called gluconeogenesis. Obviously, it's not going to be able to make glucose from thin air, so it's going to have to make it from components. And often those components are amino acids that it gets from protein degradation. In addition, the initial stress response increases both aldosterone and angiotensin. Both of these are hormones that affect your body's water balance and blood pressure. Generally speaking, they raise blood pressure and promote sodium reabsorption and thus water retention. The second stage of stress, if stress continues for more than a few hours, like usually in a fight or flight situation, stress is supposed to be resolved within, you either win your fight or you run away from the bear or whatever. It's not supposed to happen for very long. but your body does have a long-term stress response for situations that could take longer. So after a few hours, the hormonal situation begins to change. Glycogen stores by this point have been used up. You don't have a ton of extra sugar to kick around. But your brain and your muscles and everything like that still need that glucose in order to function. And as far as your body's concerned, you're still producing stress hormones, so it is still in a heightened state of energy usage. That means it's going to turn to alternate energy sources. This stage is dominated by the hormone cortisol, which is produced from the adrenal cortex. The hypothalamus, the pathway here is that the hypothalamus secretes CRH, corticotropin-releasing hormone, which causes the pituitary to secrete ACTH, or adrenocorticotropic hormone, and ACTH stimulates the adrenal cortex to produce cortisol. And you can tell from the name cortisol that it's being produced by the cortex, and other glucocorticoids. Again, corticoids means they're produced from the cortex. What these do, among other things, what these do is tell your body that it needs to liberate as much energy as possible. That means that it's going to start breaking down fat and protein. And when it breaks down fat and protein, it turns them into glycerol and fatty acids and amino acids, and these are shipped through the blood to the liver, where the liver will turn them into more sugar by the process of gluconeogenesis. So you can see if your body is actually under physical stress, you're on a long, grueling hike or something like that, you're taking a long time to run down a deer, then having all of these extra energy molecules in your blood could be very useful. However, if your stress is due to something like, you are constantly worrying about your A&P exam or something like that, this is a form of stress. Brain stress, it still causes you to produce cortisol, and it still causes your body to elevate your blood sugar levels, but you're not using that sugar for anything. So it can produce a continuing state of hyperglycemia. Your body continues to make more and more and more sugar, pump it into the blood, but you're not actually using that sugar. Now, this is because in modern society, the sources of stress that we encounter are often very different from those that our body has evolved to deal with. The third stage is called the stage of exhaustion. This is chronic stress that reaches the point of actual harm, potentially permanent harm, to the body. When stress continues for months at a time without any let-up, you actually can begin to starve. Fat reserves are gone. Homeostasis is overwhelmed. Your protein, your muscles have begun to be degraded, and this can be marked by rapid decline and death. You can actually die from overstress. Leads to protein breakdown, muscle wasting, your glucose homeostasis, your liver's ability to both produce and regulate its production of glucose starts to break down because the adrenal cortex just can't make any more glucocorticoids. It's actually run out of its store of glucocorticoids. At this stage, aldosterone has been in your blood for a long time, causing you to preserve water, and this has led to basically chronic hypertension, high blood pressure. This can cause your blood to become more basic, as well as, so blood alkalosis and high blood pressure can lead to death from coronary disease or pulmonary disease, and often in this stage, if it continues unabated, death can result from basically kidney failure, heart failure, and glucocorticoids also have the effect of suppressing your immune system. When you're under the effect of glucocorticoids, basically your body is trying to inhibit protein synthesis so that your body can use that amino acid for gluconeogenesis and stop all of the energy-hungry processes so that your body can continue to deal with whatever stressful situation it's dealing with. And that means that often you may also die from infection because your body has basically suppressed your immune system in order to deal with the stress. Basically, your body did not evolve to deal with stress that happens over the course of months. But in our modern society, this is something that happens to people on a regular basis. While stress is basically a problem of the way the endocrine system works in the body being poorly adapted to deal with the structure of modern society, there are also endocrine disorders that result from actual pathologies, things that are abnormal about the body. And endocrine disorders are almost always disorders of hormone levels. And there's basically two things that can go wrong with hormones. Either you are making too little of a hormone, and that's called hypo secretion. Remember, hypo means underneath or less. Or you're making too much of a hormone. This is called hyper secretion. Again, hyper means more. Hyposecretion can result from a number of different areas. First off, a tumor or lesion or some sort of damage that destroys glandular tissue, or that destroys the receptor's ability to receive the signals from hormones. So it could actually be you're producing too few hormones, or that you've lost sensitivity to that hormone. So some examples of hyposecretion diseases: if you have head trauma, severe head trauma can actually affect the pituitary gland. You have tissue damage or death that would interfere with the pituitary's ability to secrete a hormone, for instance, ADH or something like that. Another example is if you have if your immune system produces antibodies that don't distinguish self from non-self properly, then it can cause your immune system to attach to and to attack receptors. And these receptors could be hormone receptors on cells. That would cause your own immune system to destroy the receptors and the cells responsible for receiving particular hormone signals. This is one cause, particularly of type 1 diabetes, where antibodies destroy the beta cells in pancreatic islets that are supposed to produce insulin. So in that case, they're actually destroying the cells that make the hormone, but it's also possible for them to just destroy receptors as well. Hypersecretion, excess secretion, usually or often results from a tumor or an aberrant growth of tissue. If the tissue gets larger, and those are secretory cells, and for whatever reason you have a tumor, not all tumors are cancerous, by the way. Some of them are benign, but benign doesn't mean harmless. In this case, the expansion of tissue would result in making more of the hormone, or making the hormone in a situation where you're not supposed to make the hormone. And so an example of this is pheochromocytoma. This is a tumor of the adrenal medulla that causes excessive adrenaline production. And that can actually lead to what we just talked about, an overabundance of stress, because your adrenal medulla is constantly secreting adrenaline. You're basically always freaked out, and that leads to chronic stress that eventually can cause the body to waste away. Hypersecretion can also result from ectopic or improper stimulation of a receptor. So, for instance, in Graves' disease, what happens is that you have some misformed antibodies that look like TSH. So these antibodies will bind to receptors on the thyroid, and your thyroid misinterprets that binding as meaning that it should produce more thyroid hormone. And so this results in a type of hyperthyroidism that is due to not a pituitary source. Your pituitary is functioning fine, but your immune system is accidentally activating your thyroid to produce more hormone constantly. The main endocrine disorders are typically with, well, there are a number of them, but the ones that I'm going to talk about are disorders with the pituitary, disorders with the thyroid, disorders with the pancreas, and disorders with the adrenal gland. Pituitary disorders, there are a number of different ones, but some of the most dramatic ones have to do with pituitary secretion of growth hormone. Growth hormone can be either over hypersecreted or hyposecreted. If growth hormone is oversecreted in adults rather than in children, what it results is in a condition called acromegaly. Since you've already reached your adult height, you're not actually going to get any taller, but it does cause you to become, for lack of a better word, stouter. It causes your bones to deposit more bone tissue, thickening and cell division in the soft tissues, especially the hands, feet, and face will get larger as you just basically you get not taller but bigger, stouter, things like that. Growth hormone has its most significant effects in childhood and adolescence, and this is where disorders of growth hormone are most readily apparent. Hypersecretion of growth hormone results in gigantism, right? Which is overgrowth during adolescence. This has all of the symptoms of acromegaly, but also results in somebody who is very tall and disproportionately broad. You can see an example of gigantism in the picture of this woman here at the bottom as she proceeds through her life. Gigantism usually results in excessive stress due to the additional weight on the body. The human frame was simply not optimized to carry around that much weight, and this often results in people with gigantism having real problems with their joints, particularly in the hip and back, but often all over the body, that basically the body just breaks down earlier than it otherwise would. Pituitary hyposecretion of growth hormone results in pituitary dwarfism. guess. And so this is a form of dwarfism where the body remains proportional but just simply does not grow to its full size. This is treatable today. It's usually easier to treat a lack of a hormone than an excess of a hormone. We don't have any way to get rid of a hormone that your body is secreting very easily, other than by destroying the gland that makes it, and that has its own suite of problems associated with it. But if your problem is caused by a lack of a hormone, we can usually administer that hormone from basically, we make it in a lab and then you take it as a pill or an injection. It's not under the same level of control as it would be if it was being made by your own body, but by careful monitoring of blood hormone levels, we can usually approximate or get close enough to how your body would normally produce the hormone. So if pituitary dwarfism is detected early enough, growth hormone can be basically given to the developing child, and they will probably not experience at least severe problems from dwarfism. They would reach a fairly normal height, though they might need to be on growth hormone supplements, certainly throughout their adolescence, and monitoring of their blood hormone levels throughout their adult life as well. In terms of the thyroid, hyper and hypothyroid diseases are some of the more common endocrine disorders that are encountered. And there are several different varieties of hyper and hypothyroidism. Congenital hypothyroidism. This is hypothyroidism that is present from birth. That's basically what congenital means. Congenital means that it's something that you're born with. This is, well, if it's not detected, then it results in basically severe problems and wasting and failure to thrive of the infant. So these days, at least in westernized countries, it is usually caught pretty early as soon as you see that things aren't going right. And it's treated with basically oral thyroid hormone. You give thyroid pills. Thyroid hormone pills, and usually the brand name of that is levothyroxine. Myxedema is adult hypothyroidism. This is hypothyroidism that basically you have a functional thyroid for at least through adolescence or through most of adolescence, but then the thyroid either has decreased functionality or no functionality as one gets older. The reasons for this are varied, but many forms of it are probably due to autoimmune disorder, the immune system attacking the thyroid, or the thyroid ceasing or failing to make receptors, or as many as abundant receptors for thyroid stimulating hormone, and the treatment is pretty much the same. You give oral thyroid hormones. It's pretty common for somebody with this type of thyroid disorder to take a once-a-day pill of levothyroxine to replace their thyroid levels. One symptom of hypothyroidism is goiter. Goiter is an expansion of the thyroid gland. Basically, the thyroid gland knows that it's not producing enough thyroid hormone because it has a feedback mechanism. Basically, when you're producing a sufficient amount of thyroid hormone, that tells the thyroid gland, all right, you can back off on thyroid hormone production. Well, if you're hypothyroid chronically for some reason, then that means that your thyroid isn't getting that feedback. It's always trying to make more thyroid hormone, and if for some reason it can't, A way that it might get around that is by basically proliferating, getting bigger, and in order to try to make more hormone. But it's still not making that hormone, so it just keeps getting bigger and bigger and bigger. And that expansion is called a goiter. Goiter can result from either hyper or hypothyroidism, but one of the most previously common causes of goiter is a lack of iodine, because iodine is a necessary component in order to make thyroid hormone. So even if you have a properly functioning thyroid gland, if you're not getting enough iodine, you can't make thyroid hormone. This used to be something that was seen in populations, particularly that lived at high elevations, because iodine is water soluble, and so like in the rain, if you live at a high elevation, the rain will carry iodine out of the soil down to the lowlands. And back when people used to primarily subsist off of local produce, that would mean that the soil was poor in iodine, so the local foods would be poor in iodine, and you would be poor in iodine. And also in people who, for either religious or some other dietary reason, just don't normally eat things that have a high level of iodine in them. It was endemic in Jewish populations that kept kosher for a while. Nowadays, well, first off, nowadays, you don't usually get your food supply from just local sources, but also we add iodine supplementation, particularly to salt. Hypoparathyroidism. So remember, your parathyroid glands regulate your blood calcium levels as well as bone deposition and resorption. If you have your thyroid excised, which is often a treatment for hyperthyroidism, remember that it's very difficult to actually treat overproduction of a hormone. Often, the only way that we can treat that is by getting rid of the gland itself, excising the gland, and then now you don't make the hormone, and now we treat it as if you made too little. So you can turn hyperthyroidism into hypothyroidism by a thyroidectomy. And that is actually a common treatment in many cases of chronic and severe hyperthyroidism. But if you get rid of the thyroid, the parathyroids are also attached to that. So many cases of hypoparathyroidism are actually a result of a thyroidectomy. This can result in a rapid decline due to lack of blood calcium. And, for that reason, we usually try to leave the parathyroids intact if at all possible. Hyperparathyroidism typically results from a tumor of parathyroid tissue, and it results in basically symptoms that are somewhat similar to osteomalacia or rickets. The bones become soft, fragile, decalcified, prone to breakage. Calcium and blood phosphate levels increase, potentially to pathological levels. And because you have very high blood calcium levels, this can lead to the formation of renal calculi, which is a fancy way of saying kidney stones. And you can actually die from kidney stones. You can see here, this is a rather extreme example of a goiter. Typically, goiters don't get this enlarged these days before we figure out that something is wrong and start to treat it. But if you have a goiter that goes untreated for long enough, it can reach pretty large levels. The adrenal gland has a few different disorders that can go along with it. Cushing syndrome is the result of excess secretion of cortisol. Remember that stress hormone that we talked about earlier. And Cushing syndrome basically results in the same sort of general adaptation syndrome that we saw with chronic stress early on in the lecture. And that would be hyperglycemia, hypertension, weakness, fluid retention, which results in edema or pooling of fluids in the limbs of the body, muscle and bone loss due to the fact that your body thinks that you absolutely have to make as much sugar as possible, and it will actually degrade your body's muscle tissue in order to make that sugar, which you don't actually need. The problem is that you are just simply producing too much cortisol. Cushing syndrome results in a fairly typical facial appearance due to abnormal fat deposition, leading to what's termed moon face and buffalo hump. This is fat deposition, particularly in like the cheeks and on the back of the neck and in between the shoulder blades. Adrenal androgen hypersecretion is called adrenogenital syndrome, or AGS. This is where your adrenal cortex produces too many androgens. It often accompanies Cushing syndrome because basically it results, you have the cells of the same layer are hypersecreting, the same layer of adrenal tissue that produces cortisol also produces androgens. Androgens are masculinizing hormones, particularly testosterone, although there's a few others. And it can result in malformation of the reproductive system. In men or males, it can result in early onset of puberty, enlargement of the sexual organs, basically hypermasculinization, like instead of just getting somewhat stouter bones and a little bit of a deeper voice, you end up with a very deep voice and very, very stout bones, as well as in women, and women can get Cushing syndrome. Usually if they are born with Cushing syndrome, the androgens will cause their body to develop as a masculinized body. So newborn girls with Cushing syndrome will have masculinized genitalia, increased body hair, deeper voice, beard growth, things like that. Even though they may be genetically female, the presence of the masculinizing androgen hormones causes the body to develop masculine features. Here you can see the typical moon face symptom of Cushing syndrome. The most common metabolic disorder in America and pretty much all of the world is diabetes mellitus. This is disruption of the body's ability to properly regulate its blood sugar levels, and there are several symptoms of diabetes mellitus. By the way, diabetes mellitus, which is what we usually just think of when we think of diabetes, is by no means the only type of diabetes that exists. But diabetes mellitus has some very typical symptoms. Polyuria, which basically means excess urination. Polydyspia, which means excess thirst, probably because you're getting rid of a lot of fluid through your excess urination. And polyphagia, which means excess hunger. often because the tissues of your body are not either you're not producing insulin or they aren't seeing the insulin, which means that even though your blood sugar levels are very, very high, as far as many of your tissues are concerned, you're starving. The key symptom or sign, actually, of diabetes mellitus is elevated blood glucose levels, and particularly glucose in urine, right? Usually, you should have very low to no glucose in your urine. Your body is adapted to conserve energy as much as possible, which means you don't pee it out normally. But there's a limit to your kidney's ability to re-import, re-uptake sugar. If you have really, really high levels of sugar in your blood, then you basically overwhelm the ability of your kidneys to get that sugar back into your blood, and you end up peeing it out, even though your kidneys are working full time to try to conserve as much of it as possible. Osmotic pressure, the fact that you're losing sugar, acts very similar to the way if you were losing potassium or sodium. Basically, the osmotic pressure of this molecule leaving your body, the sugar leaving your body, draws water with it, which is what causes the polyuria. The excess urination is a result of the fact that you can't reabsorb all of this sugar in your urine. And ketones as well in your urine. Often the ketones are there because when your body is starving, it goes into a ketone or protein-based metabolism, and the lack of insulin in your blood, or the lack of sensitivity to insulin, means that even though you've got tons of blood sugar, many of your tissues can't get that sugar and actually start to starve and produce ketones. There are two types of diabetes mellitus. Type 1 diabetes is usually referred to as insulin dependent. Basically what it means is that your body is unable to produce insulin or to produce sufficient insulin. Type 1 diabetes is always treated with basically insulin supplements. Every time you eat, you have to give yourself a shot of insulin, or your body won't be able to absorb the sugar that you just ate. Usually, the method of administering insulin traditionally has been with a needle or an injection. These days, will also often people with type 1 diabetes may have a pump surgically installed that basically detects blood sugar levels and then releases insulin automatically. This is sometimes called an artificial pancreas, although it's not really an artificial pancreas. Or dry insulin inhalers. Insulin can be inhaled and absorbed through the lungs. You have to monitor your blood glucose levels pretty constantly. And when they get too high, you have to shoot up some insulin. But because, like, our calculations as to how much insulin and when insulin is delivered and how fast it works are not really as good as your body monitoring itself, it's entirely possible to overdose yourself on insulin, so you actually have to monitor for low blood sugar as well. So people with type 1 diabetes have to worry about basically both situations. The cause of type 1 diabetes is complex and not from a single source. We know that heredity plays a role, but not everyone who is hereditarily susceptible to the disease gets it. And usually, not always, but usually people aren't born diabetic. It can happen as a purely genetic state, but for the most part, people have a natural susceptibility, which probably has something to do with the genes that control the immune system. If a susceptible individual gets infected with a virus, and a particular virus, cytomegalovirus is often implicated, as are several other types of viruses. But basically, what it is that your body's immune response to this virus causes you to make an antibody to that virus, but it just so happens that the genetic antibody that you have for that virus, or the variant of the antibody that you have for that virus, accidentally also sees your cells as an enemy, and particularly the beta cells of the pancreas will label them and cause your immune system to destroy those beta cells or harm those beta cells. And then once the beta cells are dead, well, those are the ones that produce insulin. So you can't produce any more insulin. Now you're diabetic. About 5 to 10% of cases in the United States are type 1 diabetes. Type 2 diabetes used to be called adult onset diabetes, but seeing as we are increasingly seeing it in adolescents and pre-adolescents, it's no longer really called that. It also used to be called non-insulin dependent diabetes, but people are increasingly dependent upon insulin for the treatment of type 2 diabetes as well. Here the problem is not a lack of insulin production. The pancreas works fine, or at least it starts off working fine. The problem here is that the cells of the body have become resistant to the effects of insulin. So the problem is on the receptor side of things. Either they don't have enough receptors for insulin, or they don't respond effectively to insulin receptor interactions. The risk factors for type 2 diabetes are heredity. There are a number of genes, 36 at least, that are known to increase risk, age, obesity, and ethnicity. Usually it isn't necessarily one single thing. Type 2 diabetes is usually a confluence of factors that all contribute to it. But generally speaking, it is anything that is present at high levels in the body. Your body will eventually become used to it and stop responding to it. So if you have high blood sugar on a regular basis, that means that your pancreas is constantly secreting insulin, and the cells of your body become resistant to it. In early stages that are called pre-diabetes, this is where insulin resistance is starting but hasn't become permanent. Insulin resistance is potentially reversible, but in the later stages, once the cells have become completely resistant, getting blood sugar back into an appropriate framework will not necessarily allow cells to become unresistant anymore. And the situation basically becomes permanent. The pathogenesis of diabetes is that cells basically can't absorb glucose, either because they're resistant to the insulin or because you're not producing insulin. If it is untreated, then that means that they can't, your cells need energy. And even though there's plenty of energy around, they can't get at it, which means that they have to turn to alternate fuel sources, particularly fat and proteins. Diabetes can result in weight loss, weakness, fatigue, and things like that. If your diabetes is untreated, it can result in ketosis, which means that your cells are basically convinced that they're starving, and so they start metabolizing proteins into ketones that can be used to get energy. High levels of ketones can actually have negative impacts on the body. They're organic molecules that can also sort of act like alcohol, so it's possible that high levels of ketones in the blood can cause negative states of consciousness, is probably a good way to describe it. They also promote osmotic diuresis. Basically, they cause you to pee more and thus lose more water. They can cause neurological issues and irregular heartbeat. If you've ever been on a real alcohol bender, the way you feel the next day is a pretty good description of that. You can basically become hungover without ever managing to get drunk if you have uncontrolled diabetes. And ketones in the blood can make your blood more acidic naturally. So high levels of ketones in the blood cause ketoacidosis. Your blood pH is actually super important to its ability to transport oxygen, which is something that we'll talk about when we talk about the cardiovascular system. But if you change the blood pH too much, then it will interfere with the ability of blood to transport oxygen. And that can result in deep, gasping breathing, diabetic coma. If your blood becomes too acidic, it can actually cause your diaphragm to stop working, and you can die. Other chronic pathologies associated with diabetes are neuropathy and cardiovascular damage. Both of these are basically caused by the fact that you have high levels of sugar in your blood and in your body fluids, and this causes osmotic stress. Basically, it pulls water out of your cells, just like salt pulls water out of your body. And this causes damage to nerves and blood vessels. In addition, high levels of sugar in your blood basically can cause your blood to become thicker. You're effectively pumping syrup through your veins. Syrup's hard to pump, so that means that your heart has to work really, really hard, increasing blood pressure and the likelihood of cardiac distress. So you have damage to blood vessels, damage to the hearts, damage to neurons, and also potentially damage to the kidneys and the retina of the eye, which has lots of very, very small blood vessels. If those blood vessels become damaged, you can actually go blind. Diabetic neuropathy, nerve damage from diabetes, typically starts in the feet. The reason for that is because the longest nerves in your body are the ones that go to your feet. And the longer the nerve is, the more area there is for damage to accumulate over. This can result in people being injured on their feet, but not realizing that they're injured on their feet, and then the injury becomes infected, but they have neuropathy there, so they don't feel it, and eventually that infection can become a problem that results in amputation. While neuropathy typically starts at the feet, it proceeds through the body as long as the damage continues to be done. The lack of blood flow to the areas, particularly in the feet and limbs, but potentially anywhere, means that wound healing is suppressed. And wounds can take much longer to heal than normal. In males, it can lead to erectile dysfunction due to the cardiovascular problems, incontinence, and other issues.